We'd been thinking less boy band, more barbershop quartet, actually. But we haven't had time to work on the a cappella version yet. I'm Ian James, and I work for Solihull Council, where I'm Director for Communities and Adult Social Care. I'm ably supported by my NHS colleagues, but fundamentally, we think that this is about systems leadership. There are three key messages that we want to get across as part of this pitch. Firstly, our ambitious vision for urgent and emergency care in Solihull, which is part of our wider Solihull Together for Better Lives vision, encompassing work programmes around preventive services, out-of-hospital services and our hospital transformation. Secondly, we have the credibility and the track record of delivering improvements in health and social care. And thirdly, we want to say why the Vanguard is absolutely the opportunity we need to improve services in Solihull, to deliver on our ambitions and also to contribute to national learning. Our Vanguard is based on the assumption, firstly, that the majority of urgent care isn't carried out in hospitals.
So that together we can create a much more person-centred model of care that can replicate for other small and medium-sized district general hospitals. This Vanguard application will help us to accelerate our plans, because every Eileen that ends up in a nursing home is a failure of care for us.
Good afternoon. I'm Andrew Clements and I'm the Solihull Hospital and Community Services Leader. In Solihull, we are already building services to bring about the fundamental shift needed to meet the challenges of demand and efficiency, but all at the same time also fulfil our ambitions for the care of Jack and Eileen. We have a track record of innovative delivery that has received national acclaim that we are proud of and are already sharing. We've created dementia and delirium outreach teams that have taken care out of hospital into the community and back to people's homes. We've won the HSJ Awards for our joined up and innovative supported integrated discharge team, and we've also had other award recognition for some with our mental health partners, including the RAID services and the CAMS outreach service. Over the next 2 years, we're ambitious to deliver more and faster. We're redesigning our front door urgent care centre and improving ambulatory care. We are further developing our rapid response community teams and discharge to assess models. We're improving together our 7-day working, including social care. And we're providing further care for chronic conditions in community and workplaces, including Jaguar and Land Rover for respiratory and diabetic conditions. All of this is enabled by new workforce and ICT models. This, we believe, will lead to a high level of independence and well-being for Jack and Eileen. And as well, also provide beacon models of care for others, including our sister hospitals. Thank you for listening. I will now hand over to Ian.
Thank you. I'm Ian Philp. I've recently joined Heart of England Foundation Trust as Deputy Medical Director with some exciting roles. One is around place, which is I will be leading for the Trust on the transformation of our Solihull system. I have a role with people, transformation for Jack and Eileen, for older people that the Trust serves, and a role in developing stronger partnerships, leading for the Trust on medical leadership development to encourage our medical leaders to fully engage with the ambitions we have for the people that we serve. I just would like to reprise what we have tried to convey to you. One is our real excitement about what we would like to achieve in Solihull for our people. Our genuine pride in what we have achieved to date, but also our tremendous ambition to do much more in terms of transformational change. And I hope we have managed to convince you about our clear sense of place, our commitment to the people we serve, our strong partnerships which have delivered so much and could do so much more, and that by being part of the Vanguard movement we can accelerate our delivery, measure and assure success, learn from others in the network and bring an exemplar model for a small DGH fully community-facing in its local community and part of a larger emergency and urgent care network. Thank you.
Thank you to Solihull. Any questions, please?
Hi. Thanks. I'm a patient from East London. I was pleased to see your encouragement of well-being, actually, in your proposal. This is directed to all of the bids that are here today. It's not just to Solihull, it's everybody. I think all the bids are really excellent, but they are talking about managing and properly managing the people that are presenting themselves now, getting them into the right places at the right times. But I think we need to look further ahead of the people that will be coming in the future. And I think what we should be doing, if we've got friendly MPs that are supporting us and some politicians, let's lobby them to get well-being and health ownership onto the curriculum in the schools. We teach finance and money management. We need to encourage people, patients should actually own their own health. It isn't your health, you're there to support them, but I think this financially makes sense if you encourage people to own their own health. And you need to start actually in the schools with well-being and health ownership. And I would like to see some of you lobbying your friendly MPs to get this onto the national curriculum.
Well, thank you. I don't think that was a question, but could I make a comment in response to say that our Solihull Together programme is about bringing together all elements of the public sector to work on a common agenda to improve the well-being of the citizens of Solihull from womb to tomb. And and secondly, when we come closer to what we're trying to deliver on urgent and emergency care, we have a leading-edge prevention programme that will be offered to all the older people in Solihull to get a chance to look after their health, independence and well-being ahead of a frailty crisis.
Hi, I'm Simon Lawrence from the Primary Care Foundation. Given that the vast majority of contacts in health service happen in general practice in primary care, and you did talk about systems quite a bit there, I just wonder, and this is a general question really, which could have gone to any of the groups, but Solihull are getting this question, but what steps have you taken or will you be taking to make sure that Jack and Eileen can get an appointment when they need it in general practice?
Patrick?
So we're working with our primary care colleagues and we are seeing growing federations of our primary care and they are, within those federations, exploring different access models. The 24-hour-a-day, 7-day-a-week urgent care centre, which brings together our existing walk-in centre, our out-of-hours provision and our existing minor injuries provision, which will all then interconnect with 111, will then provide that sort of wraparound 24-hour-a-day, 7-day-a-week primary care. And I think the really important bit of this, which is that this has all been done with our public and our patients. So we make a concerted effort to design this always with our patients and our public at the heart of everything we do, using our Experts by Experience programme, which the Council runs, and a whole host of other patient and public engagement groups that we operate through.
Some more questions? Thank you.
While I'm really assured, and it's great that you're attending to Jack and Eileen's needs, I have to say in your cradle-to-the-grave approach, I am concerned, however, that you're not dealing with Sophie, who's their granddaughter, who has cerebral palsy with complex needs and rehabilitation. A host of young people within your community with long-term conditions who will grow to actually be a significant service and economic burden to you in the future. Can you assure me that this is part of your cradle-to-the-grave approach, actively rather than passively?
Yes, so I mean, in terms of learning disabilities, I think we're nationally seen as an exemplar for our learning disabilities in the terms that all of our learning disability patients are in the community. We don't have anyone placed. In terms of our younger population, we don't have acute paediatrics in terms of Solihull. We play into the bigger Birmingham and Solihull economy for that. But Heart of England, which Solihull Hospital lies within, is the largest paediatric provider in Birmingham and Solihull. We also have Birmingham Children's Hospital. But actually, we're also engaging. You have to engage somewhere. We're starting with frailty. We started with frailty as frailty, old frailty. We're now expanding frailty as to all frailty. And as you go into that all frailty, then you rapidly map down into your learning and your physical disability groups to ensure that we're wrapping care. And that, I think, is hopefully what Ian James and actually Sally Hodges, the Director of Children's Services, would say if she were here as well.
Hi, Mark Ellis, Intensive Support Team. Thank you for your presentation. I'm really interested in the integration with the ambulance service. We've heard some reference to that in presentations this morning, but how integrated are you with, I guess, West Midlands Ambulance Service?
I suppose it's more of a challenge relationship with us. We are very integrated with West Midlands Police and increasingly integrated with West Midlands Fire Service as well. West Midlands Ambulance Service obviously covers a very large footprint across not just the West Midlands, and it's about engaging with that. One of the pieces of work that we're just undertaking with them at the moment is around a high user programme that we're commissioning with them based on the Blackpool high user programme. So it's a piece of work that we believe will have very significant impact by befriending those high users and therefore reducing their usage on the system. So we engage closely with them through the SRG, through a whole series of other routes, but I suppose we are a part of a bigger system.
Just trying to squeeze one more question in.
Peter Walsh, NHS England. I'm interested in what's the one specific thing you think you'll be able to do as part of the Vanguard programme that you couldn't do outside of it, and also what's the one specific thing that, if it works in Solihull, we could take and replicate on a national scale?
It's your first question, what we could do without the Vanguard programme, and the second with?
What you can do if you're in the Vanguard programme that you couldn't do outside.
Oh, right, yes. Well, we're very clear that what the Vanguard programme gives us is the discipline to move at a much more pace, but in an assured way through having, I think, particularly the metrics. It's really going to help. What are going to be the key outcome measures? What are going to be the key performance measures? How can we make sure as we advance on a whole series of fronts within a coherent vision, but on a whole series of fronts and projects, that we learn quickly which are working, which we need to move away from and transfer into something else. So it's the action learning as being part of a Vanguard set that would give us more confidence in our ability to achieve the changes for the people of Solihull.
Thank you very much. Thanks very much to Solihull. Thank you.